One of the most effective ways for people to continue their recovery journey is to enter a residential treatment program. This is where people receive comprehensive treatment in a live-in environment for several weeks or even several months. This may be a good option for your child. Sending a child to residential treatment is certainly not an easy decision, but it is one of the most courageous things a parent can do. In this lesson, we're going to help you figure out whether residential treatment is right for your child. First, I recommend having a medical professional or addiction specialist evaluate your child to help you or you and your child determine the best course of action. There are a few specifics that you and your child should consider when assessing whether residential treatment is a viable option. One of the main questions is whether your child has access to a safe place for treatment. A safe place means there are built-in protective factors, such as a stable home environment, structure, and supportive people who are also sober. For example, college isn't considered a safe place for recovery. On college campuses, drugs and alcohol are readily accessible and frequently abused. This opens the door to too many temptations. If your child is unable to stay sober without constant monitoring, this will likely factor into the professional's recommendation to you and your family. So what can your child expect during their stay at a residential facility? They will be immersed in care designed to support recovery 24/7. The exact care varies by facility, but will likely include a team that will design and oversee a comprehensive plan for your child's recovery. Treatment of mental health issues through psychiatry, group therapy, individual and family support, and activities such as music, art, and outdoor recreation. The time frame for treatment could vary as well. You may find programs that are as short as 30 days and others that are 90 days or more. Length of treatment will be an important consideration when it's time to choose a program for your child. For now, the most important point is this. Your child will have the best chance at long-term recovery if they stay in treatment for as long as they need to be there. Rushing back to their familiar formal life can be tempting, but it's rarely the best course of action. Another extremely valuable benefit of residential treatment is that it provides space for your child to focus on recovery. Your child will not have to deal with family issues, problems at school, or unsupportive hometown friends. Long-term residential treatment does something else you may find surprising. It gives the brain time to heal. Substance use disorder hijacks the frontal lobe of the brain. This is where logical decisions are made. This part of the brain will require retraining while in recovery. Basically, the brain needs to take a time out. I myself am a parent of a child in recovery, and I understand that you may feel a great deal of anxiety when considering options for your child. You may also feel embarrassed or scared about sending your child to residential treatment. You are not alone. It's important for me to mention that concerns about stigma and shame often prevent parents from attacking addiction with the intensity and focus it deserves. But when your kid has a substance use disorder, time is of the essence. Allow yourself to let go of others' judgments and expectations so that you can get your child the help they need. There is one very important point I want to mention, and it's something we'll continue to discuss throughout this module. No adult child, 18 or older, can be held in residential treatment against their will. This means that if your child is no longer a minor, they will have to consent to receive treatment and will have to choose to stay in the program. The reality is that in the beginning, they likely will not want to remain in the program. By the way, this is normal. Over time, the best treatment teams will help motivate your child to move past resistance and into willingness to receive effective treatment. It is likely that you also will need to initiate some difficult but necessary conversations to help guide your child to stick with treatment. In the next lesson, we'll help you navigate the search for a quality provider.